My name is Sarah Simkin. I am a family practice anesthetist and a health workforce researcher, and I'm the health workforce planning lead for the Canadian Health Workforce Network. Ivy and I met with the folks from Buildforce just over a year ago to talk about their approach to workforce management in the construction industry. And we were really impressed with the kinds of things that they do. And so we're going to share some of them here today with you to build on the discussion of what is possible. Having just explored an international exemplar, we're going to talk about the case study of the construction industry and what's happening here in Canada. So Buildforce, we're going to talk about three things. What is who is Buildforce? What do they do, and how do they do it? So Buildforce is a national industry-led organization that works with the construction industry to provide information resources to help with managing the construction workforce. So basically, this organization provides the data that the industry needs to make better decisions. And they do this by providing timely and readily available information and a variety of resources to various stakeholders across the industry. They cover 34 trades and occupations. They look at supply and demand across these trades and occupations, and they also look into the future, providing 10-year projections. They look at a variety of geographic scales. So they provide information at the pan-Canadian level, provincial and regional levels. And they do robust modeling by employment sector. So they also stratify according to what's needed where. Here is an example of some of the things that Buildforce provides. Some of their data are available in the public sphere, and some of them are available by subscription. Here's another example of the kinds of things that Buildforce might share with the industry. And what I would say about this is, wouldn't we love to know for the health workforce, the need for workers, the expected retirements, the entrance to the workforce all the way out to 2020? That'd be fantastic. Buildforce has a commitment to collecting diversity data and reporting it. And this is an example of one of the pieces of information about that's stratified by gender. Now, Buildforce offers a variety of resources to the industry, including labor market information. The LMI information that they provide includes timely forecast data on residential and non-residential construction investment activity and labor supply and demand at national, provincial, and regional levels. And they have a team of economists and consultants with industry experts to develop and fine-tune their models and their summaries, their forecasts. They also provide training. So they have an e-learning center with online courses to help with continuing professional development for people in the industry. They have resources for recruitment and retention that help employers to recruit, engage, and retain a diverse workforce. And they also provide a number of management resources that include reports, webcasts, self-assessment tools to help support the industry in managing their workforce. So how do they accomplish all of this? Well, Buildforce Canada is funded by industry, by government, and through the sale of online courses and custom labor market information impact analyses. And this is a figure that shows the distribution of revenue across these sources. And they work with a number of different partners across the industry, and basically the industry contributes data and expertise to Buildforce, which in turn takes this information and develops intelligence that can be used to support decision making. And so basically everybody here benefits by these partnerships. Now, recently, the chair of Buildforce recognized that the challenges that the healthcare system are facing. And this quote makes me wonder whether there's a slight note of surprise at the need to resort to such extraordinary measures, which arguably could have been avoided with effective planning, such as the kind of planning that the construction industry engages in. So in summary, given that the health system employs more workers in the construction industry and contributes more to GDP, surely what Buildforce does for that industry should be possible for the health workforce.